So Jonny Dillon, and I'm a GP in Banbridge.
So Jonny, you're a GP, you've been treating your patients with care and compassion for many years now, but recently you became a patient.
Yeah, so unfortunately I wasn't feeling so well, feeling quite tired, but just trying to get on with being a busy GP on a daily basis, but knew there was something more to it. So we got some investigations, and that resulted in bowel tests, and then unfortunately picked up bowel cancer. So I moved quickly through the process, and thankfully I'm able to say that I've got good news. I've had my bowel, part of my bowel removed, and at this stage they're telling me I'm in the stage of being curative.
Well, that's wonderful news to hear, but going through what you've experienced and at such a young age, it's made you think all about the screening process much more.
Well, very much so. So on a daily basis, that would be something I really focus on for my patients, would be screening. And I'm just aware of the fact that although I wasn't picked up in screening, that possibly had screening been available for somebody my age, that is something that could have picked up my cancer earlier than this. In Northern Ireland, unfortunately, we are different to England, Scotland and Wales. They're introducing screening for people who are under 60, whereas in Northern Ireland our screening programme for bowel cancer is only for the age of 60 through to 75. And I really feel very strongly that that is something that people need to know about, and that I would be very passionate about making changes.
Do you know the figures of how many younger people do get bowel cancer?
Well, because in England they already are doing the screening in younger people, they're able to pick up on about 25 people per 100,000. So what does that mean for Northern Ireland? Well, that would mean about 200 extra people getting their bowel cancer picked up earlier, and obviously that would result in less people dying. So, for our population, I think it is so vital that we get that information out there and that we get people's lives saved.
I mean, obviously it's a goal that everybody would agree with, but there's no money in the budget, and the health minister has already said that he's going to have to make massive cuts. Why should this be a priority?
Well, because it's cost effective. So this is a condition, this is an illness that can either be picked up earlier or picked up later. So the person will still have cancer or picked up earlier. So that means that they can have potentially less surgery. Sometimes, like myself, they don't actually need to go on to have chemotherapy. So if we can keep people well and get those people to have their procedure, their surgery or their treatment at a much earlier stage, then they can get on with enjoying their life and not have the serious illness that will cost much, much more for a health service.
We'll leave it there. Thank you so much for joining us, and continued recovery.
Thank you.